The American Lung Association recognizes November as Lung Cancer Awareness Month. The CDC reports that smoking causes an estimated 90% of all lung cancer deaths in men and 80% of all lung cancer deaths in women. Doctors Purdon and Brabham, radiation oncologists at Florida Hospital Waterman's Cancer Institute, explain how new treatment options have improved your chances of living with the disease.
Risk factors for lung cancer, smoking is the biggest risk factor. And the more you smoke, the greater your risk. There's a definite correlation between that. Also, the older you get, the greater the risk for lung cancer. Now, if you never smoked, it doesn't mean you're not at risk for having lung cancer. As a matter of fact, about 10% of all lung cancers occur in people who have never smoked. And so there are some links with secondhand smoke and even third-hand smoke. So smoking's not good.
One of the tough things about lung cancer is when it's early and curable, it's asymptomatic. It doesn't cause symptoms. So by the time it does cause symptoms, typically it's too late to be effectively treated and the chance of cure is essentially lost. The early stage lung cancers that we do see and treat, often we find by accident for a chest x-ray or a chest CT done for something else. So this technology allows us to prospectively evaluate and hopefully find these cancers, not by accident, but routinely, keep small lung cancers from turning into big ones. Like many things in medicine, the trend has been towards less invasive treatment, but equal or more effective treatment. On the radiation side, we've made a lot of advances treating lung cancer with radiation. One of my personal favorite topics, stereotactic body radiation therapy, condenses what used to be 7 weeks of radiation down into just 3 or 4 treatment days, and in doing so offers cure rates that are very close to surgery with no needles whatsoever.
And that's a technique where you use a linear accelerator to produce high-energy X-rays that can be aimed from multiple different angles and coincide at the same place, specifically the tumor in the lung, and allows you to eradicate the cancer without having to do surgery to remove it. The results are excellent. They're seeing 95% local control rates with SBRT.
Florida Hospital Waterman and the Center for Medical Imaging are pleased to offer lung cancer screening CT scan.
Prime candidate for having this lung cancer screening is anyone with a history of smoking. Typically the rule of thumb is 30 or more pack years. So that's 1 pack a year for 30 years or 2 packs a year for 15 years. In the ages between 55 and 74. I'm really excited that this technology is available to Waterman. I think it will ultimately be a major step for us in reducing deaths from lung cancer, which has been, unfortunately, a very elusive goal across the last 20 to 30 years of medical therapy for lung cancer. Early screening, early detection, much better chance of cure.
According to the American Cancer Society, tobacco use remains the single most preventable cause of illness and premature death in the United States. About 44 million Americans still smoke cigarettes. That's nearly 1 in every 5 adults. November 21st marks the American Cancer Society's 38th annual Great American Smokeout, a day encouraging smokers to quit the habit. You'll find contact information for all the services offered at Florida Hospital Waterman's Cancer Institute when you click the Lung Cancer Awareness Story Link icon on our homepage at yourhometownhealth.com.